that I am very much interested in and have, I guess, got first experience in through my schooling at Columbia. So my first clinical rotation I spent out in Washington State. I was at a clinic where we did no exercises, we did no manual, and we helped people recover from chronic pain. These were people who had felt surgeries, had felt injections, had felt PT, chiropractic care, acupuncture. Like they were at the last straw, like where else could they go? And they came to this clinic. We talked to them about how pain is derived, or where pain is derived from, how it works, and how it could eventually go away. So yeah, it's great to be able to share this information with you all here and say, let's dive on it. All right, so the objectives of this presentation or for today, we want to know exactly what is pain, what are the factors that influence healing. We're going to go over the natural timeline for healing for different body parts. There's the traditional pain model that I think it's fair to say maybe you all might have grown up with. And then there's this new pain neuroscience education model that I was introduced to as a student. And then we'll talk about something that's new, that's being introduced now, or maybe being more researched now, and that's the emotional awareness expression therapy. Then we'll talk a little bit about like what actually causes the body to have persistent pain, and then identifying behaviors or that you can do, or things that you can do to change the way pain is going in your body. So we'll make it somewhat interactive. I don't want you all to, just be sitting and listening to me. I know I'm monotone. I do not want to put you to sleep. So maybe some of you can tell me what is pain. Do we have any brave souls out there who can give me an idea of what is pain?
Something that makes you uncomfortable
Okay,
and uneasy.
I love it. It's great.
You can just repeat the response.
Oh, sorry. What was your name? Ruth? So Ruth said, pain is something that makes you uncomfortable. All right, that's fine. We'll stick with one.
Even frightened. Even frightened.
Ruth is saying even frightened. And I'm happy you said that, because frightened is a bit of an emotion, right? So based off of the International Association.
I had one too. I think it makes you something that can make you stop what you're doing.
Okay, gotcha. Okay. Thank you. Thank you. So something that can make you stop what you're doing. That's interesting. And we're definitely going to come back to that. We're going to come back to that. But I have a definition here. This is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Very, very interesting that they mentioned two words, that's emotional and potential. All right, so we're going to circle back to that, but just want you to, bring some awareness to that. I'll try not to read word for word off the screen, but for those who might have difficulty seeing the screen, another definition from the same year, a different author: an emotional response to actual or potential tissue damage, and one's response varies depending on life situations, experience with pain, and expectations. What I gather from this is pain could be extremely perspective. Right, like it's going to be independent of each one individual. No one's pain is going to be the same as someone else's, because our life experiences have kind of curated how exactly you experience pain. And of course, this could be dependent upon whatever situation causes the pain in the first place, whether it be a trip and fall or a car accident, or maybe just a paper cut, flipping papers. So yeah, but just wanted to cover the definition there. The traditional factors that affect healing are going to come down to the individual. Again, I mentioned perspective. Right, so there's some individuals, they can get hurt, they can tear a labrum or break a bone, and they said, put me back out there, coach. And others who are just like, nope, that's it. I told you, if I stub my toe, I'm not playing. That's it. You know, so there's a very low tolerance for some, while there's a high tolerance for others. And because of that, there's going to be people who are maybe more active, or maybe not look at pain or maybe an injury the same way. In which case they're going to kind of live their life the way that they have been, still protecting the injury. But when we do that, again, based off perspective and our experience, that could actually boost healing. As opposed to maybe one being like a warrior and having depression, like that could definitely affect one's healing rate. Was always the severity of the injury. If I'm walking down the road and I sprain my ankle, if there's different grades, if it were like a basic sprain, I could probably get back on my feet within a week, right? But if I sprain it so bad that I break a bone, I'm probably not going to be running anytime soon, right? Of course, there's the age of the individual. I have an 18-month-old, right? So he's been like scratching his knuckles whenever he like falls. He loves carrying around sticks, and you know, he's reluctant to let go of the stick. So he loses his balance, and his knuckles just scrape the ground. And man, it's like I'm like, it's already healed. Like I can't believe, like within a week, it's already healed. If that were to happen to me, I'm gonna have to cancel my patients. That my hand is bandaged. You know, there's nothing really that I'll be able to do. And I mean, it's definitely gonna last more than a week, depending, you know, I can apply all the ice and the medication that I can take, but it'll still take a little while longer. So as we age, our rate of recovery actually decreases. Speed of recovery decreases. And then there's overall health status. So I'm thinking of those who maybe are smokers or former smokers, or maybe they were drinking, uncontrolled type 2 diabetes, all the comorbidities that you can think of. These are the things that are going to affect the body's rate of recovery. So let's say I were to tear a muscle, and maybe I tore a tendon and a bone, a ligament, maybe some nerves, you know, cartilage. Each body part is going to recover at a different rate. Muscles are getting a whole lot of blood flow, so they're going to recover the fastest. I can tear a muscle and I can be back on my feet within a day or two. If I were to do that to a ligament, you're right, it's going to take about months, like maybe, I have here, it's weeks, it's like an acute, but I'll tell you, like in the actual clinic, that can take really like 6 to 8 weeks to recover, and it actually requires like some physical therapy, like some exercising. Bone, this is a little conservative. It could take about 6 to 8 weeks, but 12 again, depending on age or your one's health. Ligaments actually need some type of intervention, whether it be surgical or maybe through injection, to increase the rate of recovery. Otherwise, they don't actually heal. What ends up being produced is like a very, very cheap scar tissue. Just imagine like the cheapest toilet paper you can think of, and that kind of going over whatever ligament was torn. And then there's nerve, which has this regrowth rate of 3 to 4 millimeters a day. That's really, really small, right? So what I'd like for you to take away from this slide is your body is going to start healing itself immediately after the injury. Whether it be muscle, tendon, bone, ligament, whatever it is. It may not be the best material, but whatever the tissue is, your body immediately starts healing. I'm sorry. So when I say that, and we think of the traditional pain model, it's your symptoms are proportionate to the tissue damage. Again, I had mentioned if I were to sprain an ankle, like a low grade sprain, I can be back on my feet within a couple of, maybe like a week or two. But if I were to fracture the bone, probably not. However, walking or being able to ambulate after spraining an ankle, that's a sign of function, like whether one can actually like move around, right? So why is it then, if I were to fracture an ankle, fracture a bone, just spraining an ankle, and a semi truck is coming in for me, or my son, make it super dramatic, right? I have to run across the street, I have to put weight through my leg in order to protect myself, or my son in this case. The symptoms are saying I shouldn't be able to put weight on it, right? But how is it that I'm able to? I got someone here who's doing this, and again, I think it comes down to perspective, right? There's this fight or flight mode that kind of kicks in, and it's something that I have no control over. None. I can't turn this thing off when I want to, right? It's just something that naturally happens. Again, I had mentioned that the tissue, no matter the type of tissue, whether it be muscle, tendon, bone, ligament, nerve, it immediately starts healing itself after an injury. Right? So I have here from hours to months, you know, there's an injury to the tissue, and then again, it immediately starts down, it's recovering. Now, this ongoing pain, that's what we're here to discuss. That's the chronic pain, right? And I'm so happy that this traditional pain model, you know, makes us start to question about the symptoms and it being proportionate to the damage, because if the tissues have already healed, why am I still experiencing symptoms? It comes down to something we have absolutely no control over. The way you can salivate from thinking about your favorite food, I mean, even if you were not to, if someone that challenged you, try to keep your mouth dry, you know, I'll give you $1 million, you know, and immediately they start talking about your favorite dessert. You're like, stop, please. Please, I want my $1 million. You know, it's not going to happen because it's something that you don't have control over. Right. Well, the brain can do the same thing with one's experience with pain. So we can throw out the traditional pain model because the pain does not equal tissue damage. So why do you still hurt? Again, we talked about normal tissue healing. It could be up to, you know, a couple months, very, very conservative estimate. But the persistent pain is due to one's nervous system, mainly the central nervous system. So there's the peripheral nervous system, which is going to give you maybe sensation and motor function to your fingers, to your toes, to your face, able to make funny faces. But then there's the central nervous system that's going to give control to your breathing, right? To your organs functioning. They're going to give rise to one's thoughts, one's beliefs, one's feelings, right? These are some of the things that might be affected maybe after a concussion or a traumatic brain injury, or even after a stroke, right? Again, things that we don't necessarily have much control over.
Can it be a little louder so we can hear it better? Thank you.
Barbara?
I can turn it up.
Thank you.
All right, Helen, I hear you. Okay. Go ahead and speak, and let's see if that's,
How was that?
can somebody let us know if that's better?
Can someone let me know?
No, it's about the same.
No, it's better. It's better. I can hear it better. Thank you.
Okay, we're good to go then. Thank you.
For the person who said it's about the same, is it okay?
No, it's still, to me, it's about the same. I don't really hear it being louder.
No, but can you hear okay?
But can you hear it okay?
Are you having problems hearing?
I sent you a message, Barbara.
Oh,
Oh, I didn't see that. I apologize.
I just sent it. I just sent it a minute ago.
Got it. Okay. I mean, I can send it up louder. I mean, this is.
for you all here, it's.
Oh, hold on. Let me. Oh, hold on. I think I figured out what I did wrong. All right, go ahead and speak now.
Okay, I'm gonna try now. Can you hear me okay, Beth?
Is that better?
No.
Is anybody else having trouble hearing?
Just to be sure, Beth, you have the volume all the way up?
Yeah.
I think it's the microphone.
No, we
The
can hear it
microphone
loud and
is
clear.
bad.
Over here, it's loud and clear.
When you speak,
All right.
not when the speaker talks.
Okay, so maybe you just have to speak louder, or you can come a little closer.
I will try
We
to
can
speak
move you.
louder if it's okay with you all here. Of course, I want to satisfy everyone, but
Yeah.
I don't want to feel like
I
I'm
think that's
screaming.
that's the
I
best we
don't
got, 'cause
actually
we've got
know
it-
what it's like.
We've got it set up the best, so I've turned off, I've turned up and made the adjustments as I can. I apologize, so.
Okay,
All
thank
right?
you.
Sure. All right, go
Beth, I'm
ahead.
gonna try to speak louder. Is that okay?
That's good.
Okay. I don't know where I left off, but I will say that the central nervous system is really what we're trying to target here, right? One's thoughts, feelings, behaviors, attitudes, in relationship to pain, right? So, reading off the screen a little bit, the body's alarm system is that central nervous system, right? This is the fight or flight. This is, I got a slight head shake. You good? Oh, good, okay. But this is the body's alarm system, right? This is letting you know that there is pain. So if one is experiencing pain and it's chronic, the tissues have already healed, it's the central nervous system that is responsible for that messaging. If I lost you there, I apologize, and we can come back with questions afterward. Just because I forgot where I left off. My apologies. So here are some essential pain facts. We got earlier from Ruth that it's about protection. You want to stop your body from experiencing more pain, right? So pain can act almost like a notification. Hey, don't do that, because you know what's going to happen, right? It can also detect, the brain detects pain stimulus. So, I kind of already said this. This is the central nervous system. I try not to say brain so much because one might be inclined to think that they're losing it, or maybe they feel weak, or maybe they're so unique that their brain is maybe attacking them, and that's not so much the case. Again, this is something that your brain actually doesn't have much control over. It's just something that has happened with the central nervous system. That same system works to protect the injury. So kind of piggybacking off of the protecting the pain, maybe you're familiar with getting up from a chair might be painful for your knees or your back. Well, going up and down stairs, maybe you haven't done in a while, but just the thought of doing that could reproduce pain, in which you would say, I don't think that that's a good idea. Of course, by doing so, you increase the safety buffer while you heal. So if you know something might be noxious to your body or painful to you, then you would avoid those things. I know at the bottom of the screen it says before and after surgery. Oh, you can't see it, that's good. At the bottom of the screen, it says before and after surgery, but really this applies to any type of injury, again, whether it be a paper cut, whether you stub your toe, whatever it may be. Your body's alarm system is going to go off to let you know that something has happened, and thus you need to protect yourself from it happening again. What tends to happen with people with chronic pain is that alarm system never actually goes back to its normal base, right? So let me put it this way. Maybe your car or your apartment has an alarm system, and God forbid, I'll knock on wood, but someone tried to break in. So great, the alarm system went off and scared the intruders away. The next day, I mean, they didn't do anything to the alarm, but for some reason, every time that the wind blew, the alarm went off. That's not right. No, I mean, the burglar's already left, your home is intact, everything is just as you left it, but every time that the wind blew, it went off. Why is that? Again, it's more to do with the central nervous system. It's already been ramped up once from this one injury. It could have been a fall, it could have been, running track and field 13 years ago, but whatever it is, you still have that memory in your head, this trauma, this experience. And you're kind of running that on a loop. You don't really have control over it. It's just a thought that comes by, or maybe it's every time you see someone else run, or just the thought of running, like it just resurfaces. guess in a way, it's similar to if I were to ask you all not to think of the yellow elephant. You know, you don't have control. It's the first thing that's gonna come up, right? And that's what can happen with this alarm system, your thoughts, your feelings regarding your pain. So the model that I was introduced to was this biopsychosocial. When the patients came into the clinic, we explained that yes, we understand that you were extremely stressed out. You were in between jobs. You were on your way to a job interview that you really, really needed to make, right? You wanted to sell with this job interview. You wanted to get the position, and you're stuck in traffic, even though you left 2 hours early, and you weren't sure if you're going to make it on time, and maybe this job can go to a different candidate. There's bills that need to be paid, and boom, you get into a car accident. It's that one more thing that you have to think or stress about. Your alarm system was already ramped up, and now it just goes over the edge, right? And now you can't stop thinking about all the other things that you have to take care of. I had a professor in grad school who says, Brando, you know, your stress about school doesn't sit in an isolated pot an isolated pot in regard to maybe your stress about sports or, you know, your basketball team. And he's right, stress is stress, right? So I can't differentiate maybe a mechanical stress to a psychological stress. And that's exactly what the central nervous system has trouble doing. That still dials back to the psychological aspect, that still dials back to the social. Because if you were to go to your doctor after this car accident and they say, yep, you have herniated disc, it looks like you have stenosis as well. It looks like the disc between your two bones is completely degraded. You might need surgery. You might need some injections before we do surgery. You should probably try physical therapy or chiropractic care. You're already stressing about these things, and now this doctor just loaded all this information on you. You don't even know exactly what it means. And then that could lead to catastrophization, right? So that's, my spine is ruined. My shoulder is going to be messed up for the rest of my life. These are things that kind of keep that alarm system or the central nervous system amped up. Hearing these things, maybe from your family. Oh, you know, your dad has always had a bad back. You know, I think it's genetic. You know, these things kind of feed into our thoughts and our beliefs regarding pain and can keep it persistent. I mentioned earlier that the tissue doesn't actually, you know, I'll say it a different way. The tissue can heal long before the pain can go away. So the biological aspect, if one can have swelling, or maybe something that feels hot or warm in their knee, back, shoulder, whatever the injured area may be, it doesn't necessarily mean that there's an injury still present. I'll give you an example. I like the ankle sprain one. Let's say I'm running around, I step into a pothole, I sprain my ankle. Not too bad, but I should be back on my feet within a week or two. But let's say a week or two goes by and my ankle is still swollen. Have I healed yet? Or is this a sign that I have still yet to heal? Mind you, I can walk around on it, I can still run on it, but there's still swelling. So something must be wrong, right? That's not actually the case, right? Because when you start to think of people with phantom limb pain, these are people who might have gotten into a car accident or any other type of accident. Many times, like veterans coming back from war, they might lose a limb or a piece of a limb, and they're saying, doctor, can you please scratch my arm for me? And the doctor is saying, the arm is gone. The peripheral nervous system, it's out of the way. Again, I mentioned peripheral nervous system is going to give you motor and sensory function to your arm, legs, and your face. But the central nervous system is what drives that signaling. right? So it's going to tell you your arm itches, even when there is no arm. So again, we'll revisit the question. If I have swelling in my ankle and I'm able to walk on it, I don't have any pain, right? I'm able to run even, but there's swelling. Does this mean I'm still healing? I have yet to heal? This is the big question mark. I think it really comes down still to one's emotions, beliefs, and thoughts regarding what you're seeing. In this case, if I were to see that my ankle is still swollen, I can say, maybe I'll elevate it. You know, there's probably still some fluid down there that just needs to get out. It doesn't necessarily mean that my ligament is torn or any muscles or nerves are torn. I just have to get rid of the swelling, right? The swelling could be like a byproduct of the initial injury, but it doesn't mean that the injury is still present. Of course, I can say that, or I can do those type of things because, well, I'm a physical therapist and like I know how to deal with swelling. But for a common person, it totally makes sense for someone to see that swelling, to see that redness, to still feel that ache and say, no, something's not right. Even though something might actually be going just perfectly well. So I have a couple videos here that I do want to share. I'm sure some of you can appreciate a different tone or, you know, just a different, somewhat different perspective. So I'm going to go ahead and play this. Oh, I think I'll have to exit. I'm going to play this video from YouTube. And without the ad, my apologies.
Once upon a time, all the lands were fraught with persistent pain.
Sorry, 1 second. Barbara? Oh, here it is, that's why.
Widespread was this affliction that 1 in 4 people experienced it. The pain lasted for more than 3 months. It shadowed their daily. Once upon a time, all the lands were fraught with persistent pain. So widespread was this affliction that 1 in 4 people experienced it. The pain lasted for more than 3 months. It shadowed their daily lives, held them back from everyday activities, and the interventions they tried proved useless. Hey, pain, go away, we've tried it all, but still you stay. Moving less, taking pills, knives and needles, and still we're sore. We can't take no more, no more. But the pain remains like a loyal companion. The people's hopes faded, and they became resigned to living with the pain. Only now the pain was a beast. Then along came a group of researchers, of which I am one. Back off, big fella. I'm Professor Lorimer Mosley, and I'm a pain scientist. Pain scientists are starting to think differently about pain and its causes, and we're making exciting discoveries, like how the way you think about your pain can change the way it feels. Over the next few minutes, I'll help you to understand your pain. Understanding is important because it can change how much things hurt and how much your body can do. And it can help you to tame the beast. First, trust me about this. Pain is not an accurate measure of tissue health. Pain is a protector. By making unpleasant feelings, your brain changes your behaviour so you can avoid injury or your tissues can heal. Sometimes pain is not helpful, like phantom limb pain. You don't expect a missing limb to ache, but it does, and the pain is very real. So how do we explain this? Well, pain is a warning signal from your brain that depends on credible evidence to say your body needs protecting. Sometimes pain's too protective and you get unnecessary warning signals. Pain scientists now understand that there are many ways our nervous system ends up producing unnecessary warning signals. Take conditioning, for example. You think of Pavlov's dog. Every time food was offered, Pavlov rang a bell. Of course, the dog would salivate seeing the food. This went on for a while. Eventually, the dog was conditioned to salivate for the bell alone. Well, conditioning is just one of the ways your body learns pain. And the longer your nervous system produces pain, the better it gets at producing it. Your body learns pain. So what feeds this beast? Well, let's look at how pain works. In your body's tissues, there are specific neurons which normally only respond to harmful stimuli, whether mechanical, chemical, or thermal. When they are activated, they send a warning signal to your spinal cord, which can in turn send a signal to your brain. This activity in neurons is called nociception, and it's happening all the time, but only sometimes results in pain. Most of the time, the brain protects you with other things, like movement. Once the warning signal reaches the brain makes sense of it based on the information arriving, and a vast amount of information already stored. If there's good reason to think protection is required, then your brain makes pain. One of our amazing discoveries is that you can have pain without any physical stimuli. Thoughts and places might activate the warning signals, and the pain feels exactly the same. But it's not just your brain. Your spinal cord also learns how to generate unnecessary warning signals. So how do you know when your nervous system is learning pain? You may notice your pain spreads or comes on without warning. Your body feels odd and it's hard to move properly. Your pain changes quickly with your mood, and small annoyances can set it off. Old injuries start to hurt again. You're more sensitive to stimuli. And the longer the pain goes on, the more all of this occurs. The old way we understood pain could not explain these things and left many sufferers feeling like no one believed it was real, or for it to hurt so badly there must be a major tissue problem. But we now know how persistent pain happens. So how can you tame the beast? Pain is a very personal thing. There's no one-size-fits-all solution. And while you probably have well-thought-out coping strategies, it's time to take a new approach to dealing with and reducing your pain, one that focuses on retraining your pain system. This might mean testing yourself physically and moving more than you normally would. Being honest about your current attitudes and beliefs can also help, as can asking your health professional new questions.
How do I know if my pain system is being overprotective?
How do I retrain my pain system to be less protective?
How do I know if I'm safe to move?
So be brave and have hope, because it is possible to tame the beast. Visit our website for more information and questions to ask your health professional. tamethebeast.org.
What do you all think of that? I know it was a lot of paraphrasing, maybe even like more condensed. It might have been like an information dump. Let me put this into the slideshow. It might have been an information dump, but I hope that was able to like bring back like some of the topics that I had raised. So I had mentioned before that my professor says that my stress doesn't fit an individual pots, right? It all kind of gets drummed up in one. So
Not
when I
hear
think-
anything.
What was that? So when I think of stress, when I think of worry, when I think of feeling overwhelmed, right? And maybe that was the feeling that I had when I actually had the injury. I don't have to think about the injury anymore. I just have to get overwhelmed again to feel pain, right? It's almost like the, when we say neurons that fire together, wire together, right? So in a way you are kind of learning to be or have this pain. I do have another video here. Maybe we can show with maybe a show of hands. Again, I don't want it to be like an information dump, but if you,
I'd like to see it.
okay, perfect.
Hi, I'm Dr. Brian Parris. There are four foods that I tell my patients to avoid if they suffer from arthritis. Can you guess which one?
There we go.
Everyone agrees that pain is a universal human experience. We now know that pain is 100% of the time produced by the brain. This includes all pain, no matter how it feels, sharp, dull, strong or mild, and no matter how long you've had it. You might have had it for a few weeks or months. This is called acute pain, and it's common with tissue damage, say from a back injury or ankle sprain.
You need to mute everyone. I think there's reverb coming through to us because of some people being unmuted.
Okay, I'll take a look. Thank you, Margot. No, everybody's muted. Oh, yeah, okay.
100% of the time produced by the brain. This includes all pain, no matter how it feels, sharp, dull, strong or mild, and no matter how long you've had it. You might have had it for a few weeks or months. This is called acute pain, and it's common with tissue damage, say from a back injury or ankle sprain. And generally, you'll be encouraged to stay active and gradually get back to doing all your normal things, including work. Or you might have had it for 3 months or more, and this pain is generally called persistent or chronic, because in this type of pain, tissue damage is not the main issue. What's less clear, though, is when you're told you have chronic pain, is knowing what's best to do about it. Well, in Australia, chronic pain is a really big problem. In fact, 1 in 5 people have it. Having a brain that keeps on producing pain, even after the body tissues are restored and out of danger, is no fun. Some people say it still feels like they must have something wrong. But that's just it. Once anything dangerous is ruled out, health professionals can explain that most things in the body are healed, as well as they can be by 3 to 6 months. So ongoing pain being produced by the brain is less about structural changes in the body and more about the sensitivity of the nervous system. In other words, it's more complex. So to try and figure out what's going on, you need to retrain the brain and nervous system. To do this, it's helpful to look at all the things that affect the nervous system and maybe contributing to your individual pain experience. What can help is to look at persistent pain from a broad perspective, and by using a structured approach and a plan, it's less likely that anything important will be missed. Let's start with the medical side. Firstly, taking medication can help, but only to a limited extent. It is the more active approaches that are necessary to retrain the brain. So using medications to get going is okay, and then mostly they can be tapered and ceased. Some people also think surgery might be the answer, but when it comes to a complex problem like chronic pain, surgery may not be helpful. So if you're thinking of surgery, it's best to get a second opinion, and remember to consider all the things. Next, it is helpful to consider how your thoughts and emotions are affecting your nervous system. Pain really impacts on people's lives, and this can have a big effect on your mood and stress levels. All those thoughts and beliefs are brain impulses too, but you can learn ways to reduce stress and wind down the nervous system. This helps with emotional well-being and can reduce pain as well. The third area to consider is the role of diet and lifestyle. Now, it turns out that our modern lifestyle might not be so good for us. In fact, what we eat and how we live may really be contributing to a sensitized nervous system. Looking at all the things like smoking, nutrition, alcohol, and activity levels, and seeing if there are any issues is a good beginning. And these things can go on your plan. Then there's often enormous value in exploring the deeper meaning of pain and the surrounding personal story. By stepping back and looking at all the things that were happening around the time the pain developed, many people with pain can make useful links between a worrying period of life and a worsening pain picture. For many, recognizing deeper emotions can be part of the healing process. Last, but by no means least, is physical activity and function. From the brain's perspective, getting moving at comfortable levels without fear, and where the brain does not protect by pain, is best. And you'll gradually restore your body's tissues. So, to sum up pain, it comes from the brain and it can be retrained. And when looked at from a whole person or broad perspective, gives you a lot of opportunities to begin. So, get a helping hand if you need it, set a goal, and begin.
Karen, if you're still there, my apologies. I did read your note saying you were getting a headache. I know that there was a lot going on in the video, lots of redirection, but I hope that you guys were able to find that to be helpful. So what I like about those two videos, not only did it condense exactly like how pain can be persistent and what it's derived from, but I felt like the one thing that was missing is really where there's more and more research that's being developed, and that's maybe looking at emotions and how that might be tied to one's pain. So this emotional awareness and expression therapy kind of actually invites one to take a look at some of their emotions that may come up from when you think about the injury or what might have been happening when you first had the injury. Some of them that I thought that kind of pointed out were isolated, I felt like sad might not capture it, but if I can look a little bit deeper or dig a little bit deeper as to how I might have been feeling like after an injury, those words might definitely capture it. If anyone is here, I won't put you on the spot, I promise, but if anyone is here who is dealing with a chronic pain, you know, I would take a look at this wheel and, you know, kind of ask yourself, like, where exactly do I sit, or where do I fit with that emotion? Or, you know, maybe do I have any ties to that emotion, or is there an emotion that maybe you've been kind of pushing away or maybe running away from, you know, because of your pain? So this emotional awareness expression therapy, in the first video, Dr. Lorimer Mosley, he talks about getting back outside and, you know, making some lifestyle modifications, but mainly going back to maybe some of those activities that you might have had issues with before. Whereas this type of therapy goes back to, like, what exactly is the role of stress in my body? What exactly is the role of stress or emotions whenever I have an injury? And then kind of writing about it. So it's not exactly pain, but when we look at the research, chronic pain actually looks a lot like stroke. It looks a lot like IBS in the way that we might be recovering. If anyone is not familiar with IBS, it's irritable bowel syndrome, right? This is where, well, quite frankly, you can't eat whatever you want to eat. Some things are going to upset your stomach, and you can have a myriad of different symptoms. Leading up to, get a little personal here, leading up to my marriage, or our wedding, I should say, I was definitely stressed out. I mean, we're inviting people from California. I mean, just calling family sometimes is already stressful enough, but to give them directions from LaGuardia or JFK and, you know, telling them that they're going to have to get an Airbnb in Inglewood, New Jersey, and they're like, well, you're in New York. You know, we were living in Inwood. Everyone wanted to know where Harlem was, and I said, yeah, it's in Manhattan. And I'm like, all right, well, where's Manhattan? It's like, I'll show you. You know, but there was a lot of stress leading up to the wedding, and I put onion and garlic in everything that I cook, all right, or at least I used to. I mean, I'd put it in cold cereal if I could. Like, I ate onion and garlic with just about everything. And leading up to the wedding, I just could not. It was this one day You know, I go to eat, you know, but it might have been like beans or like chicken or something, and I canceled everything for the rest of the day, you know. And I go to see a gastroenterologist, and he says, "Whoa, what's stressing you out?" Thank goodness, by the way, like I went to see this guy. Like it could have been someone else who's just like, "I don't know what's wrong with you. Take these pills." But he said, "Well, what's stressing you out?" I'm like, "I don't know." Like he's like, "Nothing." I'm like, "All right, it might be the wedding, you know." And he's like, "All right, well, maybe things will get better after the wedding." So we had our wedding. We go off to Cancun, right, for our honeymoon. And one of the things I cannot eat is my favorite fruit, grapefruit. And I said, "Well, I'm feeling great now. Let's do it." All right. We were there for 10 days, and because of the grapefruit, I was not able to enjoy myself for 2 of those days. And I'm like, "What happened?" Like, my stress is gone, you know? And for me, I got this persistent pain. I got this persistent IBS because my alarm system was already, it was off calibration, right? And now I'm like, all right, well, how do I get this thing down? You know, and I fasted. I took a gut-directed hypnotherapy, right? I changed jobs. You know, I did all the things to try to bring my stress levels down. And it wasn't like really for like years later that I finally started this business and started treating people privately. I kid you not, I wish it were something else, but I started treating people privately where I can kind of dictate like my own schedule, and I can hang out with my son, you know, for a greater duration of time. You know, I can ride along the West Side Highway in the middle of the day in between clients. My IBS disappeared. It was gone. It was gone. I went back to onion and garlic. It was gone. You know, and it felt good. But during that time, I felt lonely. I felt isolated. I felt victimized because I tell my wife, like, "No, please don't add that. No onion powder, no garlic powder. Please do not add that. Please." You know, even my in-laws, they're like, he's, you know, he's being trendy, you know, it's what the young kids are doing, you know. And I'm like, please, like, I just won't eat it, you know, because I didn't want to suffer from it. So, like, eating was no longer fun, you know. Like it was a stress for me, and that stress went with work stress, right? And that stress went with every small argument that I might have gotten into with my wife, and this is just getting worse and worse and worse until, you know, I finally had to do something about the stress and where it was coming from. So this feeling of, you know, any of the feelings really, I never actually did this practice where I'm writing about my trauma, but I do think, and Laura Mary Mosley, if not the second video, kind of points at this. You know, there is no one size fits all for this. If anything, I can just kind of show or tell like how one might be able to get over their chronic pain. But I mean, this is the best stuff that is out there, whether it be not the traditional PT where you're doing clamshells or bridges or something like that, but like where you can actually go someplace who's going to challenge you. And it may not be getting up from a chair, it may not be going up and down a step, but kind of addressing those fears, addressing the stress or worry, and getting back into moving. Or for some people, it might just be, revisiting the emotion that came up when that injury initially came on. So we'll just to kind of recap, we're at the end toward the end of the presentation. The factors that are influencing the pain, the video's kind of already pointed at this. I've probably said it too many times during this presentation, but actually, no, I didn't. Sorry. The sleep hygiene, one's, you know, ability to get some sleep. I know sometimes pain is so high or is so, you know, intense that one might not be able to sleep, so that's going to affect you. If you're not sleeping, probably eating. I mean, who can really stay up for so long without snacking on something, you know? Of course, there's a lack of physical activity. That could also be brought on from the pain, you know, if it hurts too much to move, then, you know, how could you move? Of course, there's the increased stress, there's the social isolation. You have your friends or maybe your family members who are going out and enjoying themselves and you can't because you're hurting. And then there's the vicious cycle of it all. Then there's the beliefs and attitude of fear avoidance, again, addressing these misbeliefs. You know, your doctor, your friend, or maybe it's a nurse who says this offhand comment, something like, well, now you have discrimination, you're gonna have that for the rest of your life, you know, these sort of things, they kind of pour into one's beliefs and they latch on to this. You know, unfortunately, I've treated people who might be in their 60s who've had this chronic pain for the past 40 years, something that happened maybe when they were like a young waitress or bartender, you know, but they were told something and that dramatically changed the trajectory of their, at least their physical life. Then there's the negative emotions, thoughts, maladaptive pain behaviors, how we kind of react to the pain or injury once it comes on. Again, I have to ask, like, what about emotions? And I think that really comes down to avoiding them altogether. So what can we do? Right? I told you everything about the central nervous system. You know it's not your brain. You're not losing it. You haven't lost your marbles. This is something you actually have no control over. This is something that's happening because your alarm system went off. It probably had a lot going on at the time, and now that alarm system just needs to come down. So what can you do to do that? I think just having that information, you'll be able to kind of reset, recalibrate your central nervous system. When you can tell yourself that getting up from a chair isn't going to make the world just explode, right? It's not that, it's not something that's going to, you know, make your spine spontaneously combust. So there's a bit of retraining, kind of being reintroduced to some of these activities that you used to enjoy. It kind of goes down to like movement. There's greater motor imagery that's maybe doing whatever activity it is in the smallest step. So if walking was painful, maybe you don't go out for a mile, maybe you just go out for 30 seconds. You did it, you know, that's worthy of celebrating, and then maybe you can try for 45 seconds next time, and then 50, maybe a minute and a half, and you kind of grade it, you increase it little by little. Lots of research on Tai Chi or aerobic exercise. This is really very gentle, very controlled movement. You're able to like bend your knees and kind of do some weight shifts. What's great about that is you are going so slow that you have to focus on what is happening within your joints, what is happening with your muscles. Of course, there is the stress reduction. You know, meditation helps for some, but I do know some people, they got the world on their shoulders, and no amount of closing their eyes and trying to focus on their breath is going to do it. In fact, there's some research like the emotional awareness where you should be maybe introducing that stress with the creative writing, you know, going back to the day or the time of the incident and maybe kind of rewriting the script. You know, what if instead of you going out for a run and you twisting your ankle, you know, and you've had chronic pain ever since, you're afraid to put weight down, you say, but one day the pain was just miraculously gone. You know, and that led to me running or going out for a walk and meeting the best friend I ever had. You know, but these are some of the things that you can do through the creative writing. Again, reintroducing the stress or whatever the emotion may be that might have been either drowned out or amped out from the injury. Yes, there's the lifestyle modifications, the sleep, the nutrition. I don't know too many people who have chronic pain for, you know, oh so very long, who are out there running marathons. You know, there's a little bit of a disconnect there, but I do feel like by changing the lifestyle, that could lead to you having less or no chronic pain. Maybe to say that differently, you'll have to kind of change your behaviors in order to change the way that you're feeling. I have a really, really good friend back in California who says, in order to feel something different, you have to do something different. So the takeaway for the presentation, first of all, thank you for joining me on that marathon, but the takeaway for this presentation is that the pain is actually producing your central nervous system. All right, so yes, our thoughts, our feelings, our emotions, they do play a part, but there's not a lot that we have control over. The pain does want to protect us and want to promote healing. You know, once we have an injury, we don't want to re-injure something or maybe make something worse. So the pain is an indication of we need to do something different or protect ourselves. And that there's just many factors influencing pain. Again, our thoughts, our feelings, our belief, sometimes our relationships regarding pain can absolutely play a very, very significant role in how we might recover. So there's always a way to reduce your pain and promote recovery, but you'll have to just find your way. So I gave you a couple of homework assignments. I hope you're okay with that. The presentation is shared, it's recorded, so if you ever want to go back to that wheel, that emotion wheel, you can pull up that slide, and I want you to think about 3 emotions that you have difficulty expressing due to your injury or your condition. So let's say maybe happiness, joy, being too, your back pain hurts so much, but what are you able to write about that still brings you joy? Because I highly doubt that this back pain is really stopping your life. You're still breathing, right? You're living for something. So I would encourage you to write about a couple of the emotions that you have difficulty expressing. The second homework assignment would be, if you woke up tomorrow completely free of pain, how would your day change? I've treated people, again, with chronic pain for 20, 30, 40 something years. And I would ask them this question, and they say, I don't know. I said, come on. You're stuck in bed, you're stuck inside, you're not dancing, you're not going out to visit family, you're not going on vacations, nothing would change if this pain was gone. It's been running your life this whole time. How would your life change? But I want you to sit with that, because I'm willing to bet that there's a lot of things that you want to do, but this pain is holding you back. So if it weren't, just want you to think of that. Just want to thank you for having me. Special thanks to Barbara. I reached out to her, and she kind of led me down, this path to giving the presentation here. And I'm very, very happy that so many of you showed up and shared this time with me. So thank you.
Thank you.
Thank you to all.
We have a few minutes. Did anybody have a question, either here or online? Okay, we
All right,
have.
so we got-
I have
Okay,
a
Chris
question,
first, and then
when I go to the doctor, the person who comes in and takes your vitals, they always ask you on a scale of 1 to 10, what's your pain level today? And then I say, look at my birthday, and you'll see. and they laugh, and then I have repeated it to more than one doctor, and they kind of agree. So I don't know, I have friends who have said you have to make friends with your pain, just keep on going. And I think that's true. When you have a little pain walking, you should keep on. I try to come to the Get Fit classes here. But I think that age does contribute somewhat because of arthritis and cartilage worn out. Am I correct in thinking that, look at my birthday?
Yeah. So for those online who weren't able to hear that, I'm going to try my best to paraphrase. Ruth, right?
Yeah.
Yeah. Ruth is saying that when she goes to see a doctor, there's someone who comes in the room and would ask, "What's your pain level on a scale of 1 to 10?" And she would respond, look at my birthday, look at my age, and I guess to imply that
that it's kind of normal.
It's kind of normal for to have some level of pain, and your question is, like, are we making friends with our pain? Are we kind of getting used to it even after the cartilage and the degradation
Or
of
like
the?
roll with it, you know, like I roll with
Just
it.
to
Yeah.
make
You know?
friends with the pain.
Right,
That's what her friend
she's
was.
asking if we should make friends with the pain, if we should be rolling with it. Yeah, so, it's an interesting question. I appreciate it. I think there's a couple of things that are happening. So when I were, if I were in the room and you were to tell me that, totally makes sense. If I'm looking at your age, I mentioned earlier, the stress doesn't fit in one pot. You've had pain at 12, at 15, at 23, you have pain at 46, you have pain at 51, right? Like all of these things, they're going to like accumulate, right? So when you have this 9 out of 10 pain in your knee and the 7 out of 10 pain in your shoulder and this maybe 3 out of 10 pain in your back, it kind of gets muddled, it kind of gets a little confusing, right? But overall, there's this cumulative pain where you're just saying, like, I don't even know how to answer that. And then you factor in, well, there's some pain to be expected from arthritis. There's some pain to be expected from this bone on bone, like my joints are clicking, like, and there's some pain or maybe stiffness to be expected when you're climbing out of bed. Do you make friends with it? Somewhat. I think it depends really on how much it has like affected you, right? If someone is saying that my knee clicks, I get this 10 out of 10 pain, you know, it's been there for years, and like it stops me from getting out of bed, I would question that. You know, I would say, all right, well, like, why is it stopping you from getting out of bed? Well, it hurts. Like, yeah, but it's gonna hurt whether you stay in bed or whether you get out. You know, so whether you make friends with it for something like that, somewhat, I would make friends with that pain. I'd say, I don't think this thing is gonna feel any different if I'm moving. And there's definitely more advantages to moving than there is to not moving. And, you know, maybe I didn't highlight it enough, or I'll just circle back to it, but when we do move, we do tend to feel better. Why? Because we've already gotten used to, again, our fear, the pain comes from getting up and walking. And at least in this example, this person doesn't want to get out of bed because the moment they put the foot down, it hurts, right? But let's say that they're able to tolerate putting the foot down for 10 seconds. Great, let's celebrate that. You can go back to sitting down, you can go back to lying down, but maybe in an hour, we'll try another 5 seconds. And then we'll try another 10, then we'll try another 30, and over time, and it doesn't have to be over a span of a day or even a week. Sometimes it can take months, but you're standing longer, you're spending more time on your feet, you know, and that pain is gonna come down because you're rewiring, you're telling yourself a different narrative. Yeah, I can get up, I can walk around. Yeah, there's pain, but I can get up, I can walk around. The sentence doesn't end it hurts too much, I'm not getting out of bed. I hope that answered your question, I'm not sure if it did.
You had a question next?
Yes,
Okay, and then your.
Which you might have partly answered, but so once you.
There's another question is about.
Yeah, no, this lady was talking first and then you're next.
When
Go ahead.
you get to the point where you understand that that level of healing should have happened, you should challenge yourself. That's what you're saying.
Oh, yeah,
basically.
absolutely.
Okay, I'm just fully trying to understand that.
What's your name?
Debbie.
Debbie? So Debbie's asking, when you get to the point where you should have healed, you should be challenging and questioning yourself, like, why am I still having this pain, right? Am I, okay. That's absolutely the case. So I treated a young guy the other day. It's unfortunate. It is actually a terrible story. So I'll tell you half of it. He got involved in a car accident, and he was told that he had herniated disc, maybe 3, maybe 5. Right? This is what he tells me. So I said, well, when was the accident? That was about 2 or 3 years ago. I said, all right, well, you know, kind of healed, you know. And he says, well, what do you mean? It's like, well, like these disc herniations, you know, like they happen, and then like it has happened. It becomes past tense. He's like, yeah, but you know, if I get the X-ray and the MRI, and I said, you know, I'm so happy you brought this up, because the research out there says that if I were to round up maybe 100 people, we'll keep the population size, sample size small, 100 people, a quarter of them are going to have pain with nothing at all to show on their X-ray, MRI, nothing, right? And then there's another group of people, we'll say a quarter, because this is really what it ends up being, between 25 and 30%, so it could be a third. where you're gonna have people who have no symptoms and a bunch of things that are popping up on the X-ray MRI. The spondylolisthesis, ankylosing spondylosis, anterior listhesis, spinal stenosis, I might have said that already, but I mean, like a long list of things that are happening with their back, and they're like, I don't know what to say, doctor, I feel blessed, I have no symptoms. Like, this happens, right? And that's because, as I mentioned before, the symptoms don't equate to tissue damage, right? But it also it works in reverse. So you can have structural tissue damage that shows up on the X-ray MRI, but it means nothing. So what I did with this patient, after informing him that, you know, the disc, the back, whatever it was from the accident, he's already healed from. I showed him a couple of exercises really to loosen up the spine. I'm gonna try to do this in front of the camera here, but he moves like this now. After he's been told, he's like 23, 25, after he moves like this, after he got into the accident, he was told he had disc herniations. This is how he moves. Why is he two-dimensional at 23? You know, it doesn't make sense. So what I did with him, I just loosened up his spine, tried to get him to back bend a little bit, give him like a little bit of rotation, a side bending. He gets up on the table, it's like, I feel brand new. I did nothing to him, absolutely nothing. I just rewrote the narrative. I said, oh, you healed a long time ago. Now he's not reading that same story. You know, I gave him a different story. I said, no, your back can actually bend. You know, you just got to move your legs this way, your spine this way. Right? I did nothing magical or nothing that any other PT could do, or a personal trainer at that. You know, it was just rewriting the narrative. So, yes, after you had that muscle strain, you know, the time has passed for it to heal. And again, we see that at a very conservative level, you know, 3 to 6 months. You should be questioning, why do I still have this pain? You know, people who have long history, 10, 20-year histories of pain, yeah, that's far too persistent.
Yes, gentleman in the corner, you said question?
Yes, you know, I had the problem of ligament in my right ankle. And then I went to the doctor, orthopedics, and he said, he took the x-ray, then he said, oh, you know, the cartilage is gone. You have to come for, either you come for operation or you never come to me again. So I never went to him. The doctor who said, either you go for operation or don't come to me. I went for the second opinion, and the doctor said, you know, you have rheumatic arthritis, and it is true the cartilage is gone, but don't go for operation. So try to tolerate the pain, and if the pain becomes severe, just take Tylenol or some other medicine. But miraculously, after a year, all the pain was gone. And apparently the cartilage was improving and the tissue really was regenerated.
Wow.
And that was really, the pain was so severe, you know. But after a year, the pain was gone. And I didn't need operation.
What's your name?
Ushan.
Ushan?
Yes.
Ushan.
Yes.
Ushan has shared with the room that he went to a doctor regarding his ankle. He was told that he had no cartilage in his ankle. He went to the doctor for pain in his ankle, and the doctor said that he wanted to operate on Ushan, or he can get out of his office and never be seen again, which is a little ridiculous, but it does happen. And that's what I meant culturally, you know, what happens sometimes when we go to see the doctor. He went to see another doctor, a different doctor, who said you have rheumatoid arthritis. He diagnosed you with rheumatoid arthritis and said that you could live with it, and if the pain bothers you so much, you can take Tylenol. And you're saying now after a year that is the cartilage back? Are you saying the cartilage is there and you no longer have pain?
Yes.
Okay. Alright, just
How
one of
did
the
you know
quick.
that, may I ask? Did you get another MRI?
Ruth is asking,
Yeah,
how does he know that?
Because I know that rheumatoid arthritis is supposed to be the most severe that anybody
Yeah.
can have. So how did you know that, you know, you were regenerating? Did you have another MRI?
Because the tape was gone.
Oh,
Ruth
so
is,
that's your interpretation.
so Ruth is asking a question, she's challenging, whether or not the cartilage has actually come back, and could it be confirmed via MRI or any sort of measurement? And I'm
Maybe
so,
don't, because the pain's gone.
so happy you raised that question, and you already said exactly what I was gonna say, I swear you did. So cartilage isn't something that regenerates. It isn't, you know, we're born with only so much of it, and once it's torn, once it's taken out, that's it, right? And that's why operations like a meniscus repair will work great for maybe like young adults or even teenagers, but a surgeon would not do that sort of operation with someone who's older, because they're only working with so much, and honestly, the body's ability to take that new cartilage or tissue, it's not gonna happen, right? So what did you do? You got this doctor who told you that you have you have pain, that you're gonna need this ankle operated on. This is like the perfect case, by the way, for this presentation, right? You get a social or a cultural norm that says your cartilage is gone and needs to be operated, right? I don't know about many other people, but I would freak out and I say, oh, that's my ankle. It's bad. It's bad for the rest of my life. Here we go, you know, I won't be able to play sports, I won't be able to run around with my grandchildren, like, this is bad, how am I gonna live? This is terrible, right? But you challenge that, you challenge the narrative, and you went to see a different doctor, and this doctor says, it's rheumatoid arthritis, you can live with it, take a Tylenol, you know? Like, that took you, or with the doctor's help, you narrate, I'm sorry, I'm getting tongue-tied. You changed the narrative, is what I'm trying to say. Now, I'm with Ruth on this. What you told yourself was that the cartilage has regenerated, and maybe that has helped you with your recovery. So, Ruth, you and I will talk about this, and I'll share it with the room, but, you know, like, as a healthcare provider, I'm like, do I challenge this person? Do I inform them? Do I let them know that cartilage hasn't come back? When in fact, they feel better. I might mix up that narrative and say, hey, the cartilage is still gone. And then he leaves and he's like, I hate that PT. My pain has come back right after he said it. No, this is something that is happening in our field.
There was something, I don't know whether they still teach it, the health belief model.
Health belief model, they're sharing the health belief.
Right, so that if you think that you're going to get better and work at it,
Absolutely.
you will get better.
Absolutely.
And I think that applies here too. You know,
Yeah.
take a Tylenol when you can't handle it anymore, and then you handled it, and it's good, and it's
Right.
good.
This
Yeah.
health belief model,
Yeah, I know.
belief, central nervous system, emotions, thoughts, feelings, behaviors, absolutely, yeah. I wish we can go back to teaching that in school. That would be awesome. I might be out of the job, but you know, it would be nice if we can go back and help our world with chronic pain.
But do you talk to the people? I mean, this was the whole thing. You kind of talk to the people.
Who's this?
Your profession. What
Oh
is
yeah, I don't know your name.
Luciana? How do you
Luciana.
describe your title like?
Okay, and this is the last question. 'cause we're
Okay,
running
Yeah.
Luciano?
Yeah.
She's asking, what do I do? I'm a physical therapist, and yes, we talk to people about their pain. It's not a hour-long presentation, you know, sometimes it can be. When I started out as a student, it was an hour-long treatment session in which we would talk to them about pain the whole time. It was very much like this, just sitting in a chair, and we're just going through flashcards, and we're talking about it, and I swear to you, there was one physical therapist, I'll keep it short, there was one physical therapist that had an OCS. This is like the best type of PT that you can get. It's an orthopedic clinical specialist, right? So she comes in, and as a student, I'm already skeptical. Ruth, you and I, we're good. But and I'm like, this isn't gonna work. You know, like we're gonna talk to this person about chronic pain, she's coming in for a neck. And I kid you not, this woman said, I came here with a headache, and after this talk, it's gone. There was no medication that she had taken. She didn't drink copious amounts of water during or before her treatment session. It wasn't that she was low on blood sugar or hadn't eaten anything that day. No, it was a throbbing headache. She had begged us to do some manual because she knew exactly what would help. She wanted us to do a cervical manipulation. We said, could we just talk about pain first? And she said, my headache is gone. So again, I think it absolutely comes back to absolutely educating people on how pain is produced and how it can be persistent. Thank you.
Thank you.
Great questions.
Thank you so much. This is really very informative. Thank you. All right, and thank you guys for coming.
Thank you.
All right, take care. Bye, Reedy.
Bye.